As joining us. I was just letting some time pass for those who are logging in so they can get connected. So welcome. So this is a webinar called Observe How They Serve, Evaluating Youth-Led Assessment Tools. And this webinar will be entirely co-hosted, co-facilitated by youth members from two different youth councils. So one is from the TAC, which is the Adolescent Champion Teen Advisory Council from the Adolescent Health Initiative, as well as we have some folks from My Voice representatives, which is from MOASH, the Michigan Organization on Adolescent Sexual Health. So just a few housekeeping items real quick. As a participant, you're being listen in only mode, so we cannot hear you. If you do need to unmute at any point, you can raise your hand in the chat and we can let you know with the controls. And this webinar is being recorded. And just so everyone knows that you will have options to view the recording after the webinar as well as the slides. So we'll get that to you afterwards. So yeah, just some housekeeping things. Like I said, this webinar is being recorded. And we will encourage you to participate in different parts of this webinar today, either via the chat function, which on Zoom is this button right here, or if you have a question, we do have a little bit of time set aside for Q&A at the very end of this webinar. So if you type a question in the Q&A box on your screen here, we'll hold those to the very end, or feel free to chat in at any time. And if there's a question that one of the youth members asks the audience and you want to unmute yourself to answer it, just raise your hand and one of the co-hosts can unmute you as well. So I just wanted to kick things off and say welcome. Thank you so much. And we hope you enjoy this webinar. So I'm going to pass it along to Taryn real quick for introductions.
Hi, everyone. Good afternoon. Thanks for joining us. I'm Taryn Gall. I use she, her, hers pronouns, and I'm the executive director at the Michigan Organization on Adolescent Sexual Health, or MOASH.
And I am Valerie Gavrilla. I'm a program specialist at the Adolescent Health Initiative. My pronouns are she, hers, and hers. I'm also the co-facilitator of TAC at AHI.
Hello, everyone. Thank you for attending our webinar today. My name is Jaren. My pronouns are she, her, hers, and I've been a member of TAC for about a year now, which I'll explain more later.
Hello, everyone. My name is Sampurna. My pronouns are she, her, hers, and I am a member of the My Voice Council of MOASH, and this is my second year on the council.
Hello, my name is Grayson. I use he, him, his pronouns. I am with My Voice for MOASH, and I've been working with MOASH for about 3 years now.
Great. So just a little background information before we get started. AHI MOASH submitted a collaborative proposal to the Ginsberg Center at the University of Michigan to get funding from their community engagement project for our youth-driven assessment of health center spaces in Southeast Michigan project. And this will come up more throughout the next hour, but research shows that adolescent patients access primary care services at lower rates than any other group. And that's for multiple reasons: cost, confidentiality, inclusion, representation, other issues related to accessibility. And we know that youth-driven health center assessments have proven to be a powerful approach to generate meaningful learning and feedback for health centers serving adolescents to ultimately improve accessibility and utilization of health centers. So understanding this, both AHI and MOASH had each already developed, prior to this collaboration or any collaboration, similar youth-informed tools to assess the youth friendliness of medical clinics. And when we learned about each other's tools, we didn't want to be duplicating efforts or promoting one tool if the other was clearly providing a better assessment. So a large part of the project that we'll talk about today was to evaluate each of our evaluation tools. So very meta. And through that process, also providing feedback to youth serving clinics in Southeast Michigan. You'll also see CTAC noted on the slide. We worked closely with the Community Technical Assistance Collaborative at the University of Michigan to support with evaluation of the entire project. And the goals of the project was to build capacity of clinics to provide adolescent-friendly services to young people, develop a process for youth-led post-assessment feedback, and determine next steps for utilizing the complementary tools, the one from MOASH and the one from AHI. We also want to point out that we were intentional in our efforts to approach this issue from a place of equity, not just equality, in understanding that due to greater systemic oppression, certain youth and certain clinics may have needed throughout this process additional tailored support and resources in order to assess and improve healthcare settings to best provide health services to young people. And I'm going to pass it off to Jaren to share more about AHI.
The Adolescent Health Initiative, or AHI, is based out of the University of Michigan, and they provide training, technical assistance, and coaching to healthcare providers, health systems, and organizations across the country to improve adolescent-centered care. Our vision is to transform the healthcare landscape to optimize adolescent and young adult health and well-being. And you can find us at www.adolescenthealthinitiative.org. So TAC, or the Adolescent Champion Teen Advisory Council, is a diverse group of youth aged 15 to 22 in Washtenaw County area who serve as an advisory council to the Adolescent Health Initiative. And in the spirit of nothing about us without us, AHI relies on TAC youth to inform its programs, help plan and execute the annual conference on adolescent health, and develop new programs and projects that integrate youth voice into adolescent healthcare. And actually the tools that we'll be talking about today were done and advised by TAC as well as MOASH.
So MOASH stands for the Michigan Organization on Adolescent Sexual Health. And as an organization, we strive to mobilize youth voices, engage community partners, and inform decision makers to advance sexual health, as well as identities and rights around sexual health. We mainly do this by organizing board members and things like that to create better noise and projects like this one around things within adolescent sexual health, specifically my voice, which Samporna will explain since we're both in it.
Yeah, so Grayson and I are both on the My Voice Council. At MOASH, we have multiple advisory councils, and our council is a group of diverse young people around the ages of 14 to 21. And we work to provide a youth experience and perspective to other organizations and researchers and brochures and propaganda that are targeting teens and sexual health education services. We basically exist to inform services and programs and evaluate materials created for youth. And we assist community partners in creating better presentations and materials to youth. And additionally, we are involved in lots of various presentations, panels, and advocacy efforts such as this one. And yeah, we try to improve services for youth across the state.
So what are we trying to accomplish by the end of today's webinar? Well, we want you to understand the importance of youth-led healthcare assessments, examine youth processes in evaluating reliability and validity of the two tools that we'll be discussing today, and its possible future replication of the methods by participants. And then we would like you to provide guidance for implementation of youth-led assessment tools as a standard of practice.
To kind of get everyone's minds going, we kind of thought of two questions to kind of prompt. The first one, they're both going to be in polls. The first one being, have you ever asked for feedback on your health center space? And then kind of a follow-up to that, have you ever asked for feedback specifically from adolescents before? Not just pediatric patients or adult patients, but specifically from youth. So we have our poll that is showing up or should be showing up on your screen right now. If you just want to answer either yes, no, or unsure about both of these questions to just kind of get everyone's mind going and provide a little bit of engagement, even though it's a little bit one-sided here.
Thank you, Grayson. We have some votes coming in, so I'm just going to see if we can get a few more participants in before I end the polling and share the results. All right, I'm going to close the poll in about 5 seconds, so if you haven't gotten your vote in yet, you may want to vote. See some people changing their answers, maybe. All right, let's share the results.
I love to see that people are obviously looking for feedback on their health centers. It's always great to improve and, do better, and also to provide specifically to people who get healthcare at a less amount, such as adolescents. So by seeing more than 50% of all of you have specifically asked for adolescent feedback before is really, really great. And hopefully we can show you other ways to get that feedback from adolescents moving on in this presentation.
Hi, so what is the value of our youth-driven healthcare assessments? So why do we do this? So right now I'm going to ask everyone if you have any ideas about what the value is of this assessment, just chat it in. Share any of your ideas on why you think that it's important to give value to these assessments. Any ideas? Oh yeah, I see that. Youth are experts on youth. Yeah, so we are able to show our experiences, and you can't really know a youth's experience unless you ask them. Yeah, great answers. So for us, we came up with three big reasons that this has such good value. And we start with multiple perspectives, as you guys are all saying, that we don't know everyone's perspective unless we ask for them. So it's important to get the perspectives of healthcare centers, young adult parents, youth, young youth, adolescent. You just need to have the different perspectives to create that inclusive space, making sure that you're inclusive to multiple youth communities, and make sure that you're addressing health disparities that you may not automatically notice. Next, we have representation, which we aim to represent youth and make sure that our youth health centers are empowering youth voice. And lastly, reflection, allowing our health centers to actually articulate, to look at our feedback and see if they can implement the changes coming from the youth about how to make their clinics more inclusive and better suited to help youth. And I see that, yeah, we don't often understand the youth experience and assume practices and policies for them, which is often the case because, as you said, youth are experts on youth, and we don't really know unless you ask.
This is a short video created by other youth at the AHI. So it's what does it mean to be a youth-friendly health center?
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait, but hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plants are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Y servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ plus youth, such as a rainbow sticker on the door.
Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the exam room.
Of course, we expect it to be clean and professional, so what matters most is our interaction with our doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having your confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so is doing check-ins throughout our appointment to make sure we're on the same page.
Remember, not all situations are the same, and not all teens are the same. When in doubt, ask us.
Okay, so we just want to warm up the chat a little bit for a little reflection and sharing of ideas. What are some youth-friendly characteristics that you may want to seek youth feedback for in your own organization? How easy it is to make an appointment. That's good. Wi-Fi, how comfortable the waiting room is, what programs are offered, how these should be delivered to them and their feedback. How comfortable does the staff make the environment for the teens? Bus routes to get to these facilities. So yeah, a lot of good questions about accessibility for youth.
So as we just saw from the video, but then also everything that people are saying in the chat, there are a lot of different factors that go into accessing youth friendliness. So it can be kind of hard to pinpoint how we actually figure out how to implement these things or access things like youth friendliness. And we're going to introduce to you two tools that consider all of these questions that go into how to access youth friendliness in kind of a much easier format that hopefully is much easier for everyone to understand and implement within health facilities. So these two tools, one is called the YEAT, which stands for the Youth Equity Assessment Tool, which is created by MOASH. And then we also have the YLA, or the Youth-Led Healthcare Assessment Tool, which is created by AHI.
So the Youth-Led Healthcare Assessment Tool, or the YLA, consists of 23 questions about the health clinic in a qualitative kind of manner. So you answer no, partially, or yes. And it's completed by youth in a walkthrough in-person kind of way. And it's generally after hours. You will have a couple members of the health staff there just to answer some questions, but it's really youth-driven. And this tool actually comes with a facilitator's guide. So anybody who plans to do this with a group of youth is all set and ready to go. And we'll get more into how you can access this resource later. So this is what one question of the tool would look like and the possible answers. So the healthcare is open during hours that are convenient for young people. An answer of no may look like it's only open 8 to 4, not very accommodating to school schedules. Partially, the health center is open until 7 p.m. one night a week. You know, it might be really busy that one night. And yes, the health center is open until 7 p.m. 3 nights a week. And then at the end of the YLA are some open-ended questions and observations that the youth can really put their what they saw and feedback and improvements in in a paragraph form. So what do you like most about the health center? Some of the strengths. What is one thing you would change to make this health center a better place for youth? So improvements and recommendations made by youth. And would you recommend this health center to your friends? Why or why not? And this is a really good question about how comfortable the youth feels, because they wouldn't recommend it to their friends if they don't think it's an inclusive and good space for adolescent health.
So a little bit more on the Youth Equity Assessment Tool, or the YEAT. Unlike the YLA, this is to be taken kind of on a personal level. It is used to be implemented as a secret shopper method. So people who are trained are going into health facilities as long as the health facility is notified beforehand, and they are during their appointment, they are taking this assessment tool that goes over a multitude of different elements that will be kind of interactable within an appointment, such as, before an appointment, so how easy it is to schedule that appointment outside the clinic. So if the area is nice, if the hours are posted outside, then you have front staff. So how nicely are you kind of welcomed and given and taking your information? The waiting room, so how are they set up? If they're inviting, how comfortable they are, different magazines or media that are posted around the waiting room. Bathroom, so if bathrooms are gendered or if they're unkept. And then just also the clinic room, or just the exam room, the promotional posters that I put out, if they're inclusive, if they are good information, if they're inclusive information. We also have the just clinic and medical staff in general, how well they're treating patients and people who come in. Also, a whole section dedicated to the resources and the printed information, if that's language or religious and just personal belief, inclusivity. And then we also have a section for final thoughts and suggestions that is a little bit more open-ended. So to give a little bit more of an insight of how these questions are formatted for each section, they will kind of go around the same questions asking, about observations, mostly on a Likert scale system of yes to no to sort of, but then also including an other section if the person wants to create a free-form response to give more information about the item or the place that they're observing. And then at the bottom of each section, they're also provided a comment section, so they can put down any other notes that aren't covered in the questions that are already given to them within that section. So it's very inclusive as far as answers go. And then kind of to explain more of the protocol within implementing the YEAT, the people who are going in to provide the YEAT to health centers, they are trained before going in and taking this kind of as a secret shopper. Like I said, clinics have to beforehand say that they are open to being assessed kind of on a very raw status of just people coming in without knowing who's who, and making sure that they are truly being assessed for how they operate on a day-to-day system. We made sure that the YEAT is created kind of with cost effectiveness in mind. So a person that is doing the YEAT in a health center, they are scheduling an appointment to have just an STI test, that being chlamydia and gonorrhea screening. So very low cost as far as that goes. And then this is also accessible specifically through the Google form. And since this is created by MOASH, we are willing to work with health organizations and health centers to help implement this into their centers to help be assessed in that sense.
So yeah, a little bit more about the overall process. So when we were evaluating these clinics, we had multiple clinics, and some were only YEAT specific, some were YLA specific, and then some had both the assessment for the YLA and the YEAT, because we see that the results from these surveys are a little bit different in their methods and the results that the feedback that they provide back. As Grayson mentioned, all of these healthcare centers were agreed beforehand to be part of this process and really wanted the feedback back from us. And our responses basically answered user experience questions. And in the YEET, as Grayson said, we were doing a very cost-effective appointment that many teenagers already could have used just by a quick gonorrhea chlamydia test. And for the YLA, we went in groups afterwards, after hours, and were able to like discuss. And so additionally, we did a focus group with CTAC. So as Valerie described in the beginning, CTAC is the University of Michigan Ginsburg Center Community Partnership to help with the data and evaluation called the Community Technical Assistance Collaborative. And then we kind of went over this information and reported it back to the healthcare centers. And this process happened over several months.
So to kind of give like user experience, we're all just gonna go kind of down to explain our own experiences. I personally was involved in 2 YEET assessments. Both of them went really well. I was very pleased with how just the overall care that I was given. Although I made an appointment just to get a chlamydia and gonorrhea test, at both appointments, they also offered me further testing. So I could tell that they were also just generally concerned with my health outside of what I was looking for, which was very helpful. But as far as implementing the YEET during my appointments, it was quite easy. Even though it's on my phone, it kind of created a very nice space for me to make less awkward communication, either waiting in the waiting room or waiting for the physician to come in to either give me my results or kind of give me my urine sample cup, anything like that. It was very easy to use in that sense. So yeah.
I completed the YLA at 3 clinics, and I really appreciated that I was encouraged to ask questions. It is kind of like a physical observation of the health clinic, and I really liked that I could ask questions that made the clinic think about their accessibility and speak directly to the providers and, be like, why don't you have this? And then maybe it's a question of funding or something else. So to really hear their side of things too. And I remember one experience, a clinic had free condoms that they would give to their male patients, but women had to ask for that. So I think that after doing the assessment and giving feedback on that, making condoms accessible for everybody and not just on a asking basis for a woman, really made the clinic think about that, and hopefully they change the way that they did that, because that's what we can hope for after this, is that they'll really take our recommendations and that they're not doing it just to do it, but to really help their adolescent patients and make it a more inclusive environment. And then another thing that I really enjoyed, and Sampurna also said that she did, was the inclusivity of the different health clinics and how they achieve that. So I remember seeing a couple that had like really nice posters and artwork with great messages all around the clinic, whether it be in the waiting room or the hallways. And I remember going to one where they had a poster, and patients could call or get help from the staff to call for translation services. So that was really cool.
Yeah, and lastly, I did both the YEET and the YLA at multiple healthcare centers, and I kind of got to see the difference and importance of both of these surveys. For the YEET, there was more specific evaluations of a very detailed list of things that we were checking off. So it was like a checklist, kind of holding healthcare centers accountable to processes that they expected or might not even have realized that they were leaving out. As Jaren was saying, there's a lot of small experiences that might get overlooked, that either a healthcare center is doing really well or not meeting that requirement. So there were some healthcare centers where the appointment was amazing and I got really great assistance, and there were some where I had really long wait times and inconsistent clinical experiences. In one group, I was asked to just sign signature boxes without any reference to what I was signing or what the experience of consent was or what I was signing to. And these are small experiences that may just seem routine in your day, but make a huge difference to someone who's getting their first appointment or is putting themselves out there to come and take this test. Sometimes a 2-hour wait experience might cause someone to leave or be, be held accountable in another way that they weren't expecting. And additionally, in the YLA, I found this really interesting as well because the YLA allowed you to spend as much time as you wanted to kind of write these open-ended free response questions to respond to what a clinic was doing really well and what wasn't meeting our expectations. And the requirements of the YLA were a little bit more open-ended, but it allowed us to kind of see how different health centers were doing different things to still create that inclusive space. And that was really cool as well. So afterwards, after completing both of these evaluations, we have kind of assimilated all of our data and put together some key themes that we saw addressed in these tools. And some of those are the length, the inclusivity, and the focus of our questions. And so we noticed from the lengthwise, the YEET is a very long evaluation and involved. And being very time consuming, a lot of participants may feel rushed while doing this. And while this doesn't have to be the case, oftentimes I actually ended up going back and retyping some of the questions after I finished my appointment. It's still a lot of material to cover and be aware of while multitasking. So that's definitely a more involved and difficult tool that requires a little bit more training. And for the YLA, participants did find it to be a lot more easier to use and fun and was less rushed, which also could be in part of the group discussion and the ability, I think Jaren discussed about how you got to spend time kind of talking to the healthcare professionals and asking questions about the way that they ran their clinics. And from both of these, there were suggestions made to add more questions and add more specific information. And for the inclusivity, we noticed that participants agreed that both the YLA and the YEET were both very inclusive in detail and included cultural inclusivity, physical abilities and accessibilities, and youth friendliness. And both of these tools were able to assess those really well. And then lastly, the question focus. After finishing these tools, many people might see or note specific things that they might wanted to add to this tool. So we did find that out of our discussions of these tools. And then we noticed that we could add stuff about financial accessibility and demographics of respondents and information like that. Additionally, we did have question fields on the YEET that allowed for elaboration, and same with the YLA, where you could discuss more things that you felt like that came across your mind or you noticed. But we did also find suggestions for more questions and assessments from the feedback that we got from the discussion group. And then lastly, this is a pictorial representation of the feedback that we received. And as you can see from the YEET, we saw that in terms of cultural inclusivity, youth friendliness, and physical accessibility, this tool seemed to actually capture that really well. And I think it's important to note that there was also a fourth option past this that was like the no option. And we just don't seem to have any of that represented in this chart. Additionally, with the YLA, we see that it was very clearly represented and was a good evaluation of cultural inclusivity, youth friendliness, and physical accessibility as well. The increase in the accuracy of the YEET is just in probably the sense that it was a more involved and detailed procedure that had more questions and more input received.
So going off of Samporna, and she touched on that, there was a focus group and survey completed by participants of the YEET and the YLA. And specifically for the YEET, they reported that the length was something that they would consider changing. Like she said, you're multitasking, it's a secret shopper type of format, so it can be time consuming and kind of difficult to juggle both at the same time. And most participants agreed that all the questions asked on the survey were important. However, they can be refined. So it is suggested that moving forward, questions on the tool are reviewed and condensed in order to prevent any overwhelming feelings that may arise when youth are taking the survey. In regards to the YLA, a common theme reported was that the questions focused mainly on the atmosphere of the health center, and participants reported that it is a necessity to include the personal interaction between the health professionals and the youth, because that's a large part of patient experience. The evaluation team also recommends including questions that pertain to diversity, equity, and inclusion, and how the intersecting identities of youth impacted the quality of treatment. Because we do know that unconscious bias and your identity could play a role in how you're treated at a health center. In addition, participants indicated that on both the YEET and the YLA, questions should be added that address the youth-friendliness of the health professionals, as there were experiences where the health center was not very youth-friendly, but there was no particular place to report this observation on the survey. Another little piece of advice from the evaluation team was to keep the tools separate, because they both have a wide range of pros and cons, but the pros and cons of one seem to complement the other. So these tools kind of hold hands nicely. The YLA builds camaraderie among the interviewing group, empowers youth to speak one-on-one with clinic staff, gains information that may only be available to staff, and shows the youth the overall vision that the clinic is trying to encompass on their side. While the YEET supplements this picture with the day-to-day reality of how the clinic operates and the unique experiences that patients encounter firsthand at the clinic. Therefore, the evaluation team recommends keeping both tools and keeping them separate. And if possible, it may be the most beneficial to have the same youth use both tools for the same health center to give them a more full picture of the clinic. Lastly, to follow up with the health center to better understand where they're coming from. I believe there was a question about this in the chat of like, what does a follow-up look like? So, community health centers may have valuable insights on their own context and how that affects the scores on the YEET or the YLA. For example, is there a funding issue that is limiting staff capacity? Overall, the evaluation team recommends an open discussion with the health centers, either while using these tools or when the data is returned to them. This could be in a presentation format or just a casual open discussion. So your clinic and your team can learn more about how the factors on different levels, such as interpersonal, community level, systemic, to create the reality that the health clinic and its patients are experiencing.
So when we put the YLA and the YEET into application, it was about a year ago, and healthcare and health services looked a lot different a year ago. So we kind of wanted to think of some ways for present day implementation. So we do actually see that there could be an opportunity to implement both or either of these tools in a telehealth appointments. So some of these aspects like wouldn't necessarily be necessary, such as the visuals of outside of a clinic, because this is all online now. So this instead might look at how virtual services are accessible on websites for youth, but then also maybe looking at health education being sent out as a follow-up, kind of like how Jaren discussed. Keeping that conversation going between patients and healthcare providers in that sense, and kind of assessing how those would be implemented on an online service format. We also kind of thought of different additional components that could be added into the online kind of application of either of these tools. So that might be including or affirmation of youth with disabilities, even though the current E and YLA are inclusive of different abilities and how they are represented in the medical spaces, including how they are affected on an online presence could be very beneficial to feedback on a healthcare system. And also identifying racism and bias within clinic settings, especially on a digital landscape, whether that be the health resources that are being sent out as a follow-up or anything like that, just kind of seeing where a bias might lie within a health center. There is a question in the chat that, do I have time to kind of answer this or, okay. So it asks, can you share more about identifying racial biases in a clinical setting? Have you explored any ideas? So when we did our focus group, obviously the way that the health centers were being kind of presented in that light, they were doing fairly well for the ones that we had seen in as far as the YLA and the YEET were asking about representation as far as like, posters and brochures were going. So on a digital landscape, we kind of brought this up in one of our focus groups to create this presentation. Some healthcare providers have kind of created like, the green screen backgrounds, whether that be of inclusive pictures such as inclusive for specific like LGBT identities or Black and Indigenous people of color identities, anything like that, to just kind of show that these spaces are open, but then also that could be including brochures and other further health kind of promotion that is inclusive of non-white bodies that could be helpful to be inclusive within a clinical setting outside of a specific kind of face-to-face interaction. I don't know if anyone else has situations or kind of examples, but those are the first kind of two that come to my mind. And then there's also a question that is on the slide that says, what are other suggestions for utilizing youth feedback in present times? So personally, what have any of you been trying to do to utilize this feedback now, because we're all trying to figure it out? And then if you've had any success stories, we would love to see things going well. So if any of you want to drop that in the chat during this time.
This might be a question that might take some more thought to it. So we're just gonna let that pepper in your brains for a little bit. Oh, we did get maybe one response, and then we can read these out loud if we want to keep moving through the slides right now too.
So it says, they thanked me for sharing to the question. Do you want me to go over right now or later? Okay. It says, but that just outward display of inclusion, but what about the sense of belonging after the joy space of welcoming? So that, the outward display of inclusion, I feel like that's a harder thing to try to kind of create a sense of belonging. I don't know if anyone else might have a better answer or grasp on how to create this sense of belonging within a medical space, especially online, because I feel like that might be harder to do. So maybe we could come back to this question and maybe I can try and think of something better or anyone else can. But in the time being, this is a very good question and I'd like to think about this.
I can just say, I think that by starting off with an outward display of inclusion, that's already going a long way. And it's already kind of establishing that this is a safe space. And with communicating that, especially verbally at the start of the telehealth appointment, or when it's back in person, that kind of creates a sense of belonging. But that's kind of hard to answer because it would really depend on how the person feels with the provider and maybe their past experience or just how comfortable they are being in that appointment that day. But I think that trying to think about, you know, your patient demographic and think about how you can, what you could say or what you could have in your clinic to make them feel more inclusive, and also, you know, training staff to be respectful. I mean, you know, you would hope that they would be respectful to everybody, but sometimes there are instances where people are tired or they just don't feel like being at work that day, but really trying to push that space of welcoming for everybody and all identities.
And yeah, I'd also like to quickly add that I think that what Jaren was saying is just having that open like outwards display of inclusivity is already a big step towards making things feel better and feel more comfortable. But as a for more sense of belonging and communication, I think it's just really important for healthcare providers to be open about their possibility in making a mistake, being open to correction, being open to conversation, and just trying to make people feel like they can be themselves and respond in a way that they will get the help they need, or like they can get assistance in any way that they feel and feel comfortable in asking for that help. So I think that relationship, just being there for the person, listening, and being aware of your potential like mistakes and being willing to take criticism and open to that conversation is always helpful as well.
Yeah, so I think like a good example of staff training would be, let's say your receptionist is helping somebody and that your patient corrects them with their pronouns. So teaching your staff to like not make it an awkward situation or say something like, oh, I didn't even notice, you know, just moving on and being like, okay, I'm sorry. And then just using their pronouns for the rest of the appointment and, you know, trying to really relay that.
Yeah, for sure. And also, not just for the biases, I also had a situation where in one of my appointments, I was just really uncomfortable with the provider there. And not because of anything she was doing, just because it was really late in the day and I think she was exhausted as well. And I was given the wrong test. And it just, I know that if I was a little bit more uncomfortable or not in a setting where I was evaluating someone, I might have taken a different panel just because I was uncomfortable asking or telling them that they made a mistake. And I think that just being able to have that open relationship and be kind and just be open kind of goes a really long way in being comfortable in an appointment and being able to talk and correct people that are trying to help you. So yeah, so how do you do this at your own organization is a big question. So let's get into that. So first, like setting your goal, like what do you want to gain from this? What do you want your healthcare center to get from this? And what do you want to see? So that kind of falls into how you find your participants and find the tools that you plan to use. So for us, we did this as council members of a youth advocacy group, but it would be, there's many options for you to choose groups of people that could do these assessments for you, whether that be current patients that you have or youth council members or non-patients. It's up to you how you want to put your assessment into action. We did say that it would be difficult to do any type of assessment that isn't totally blind, because it's really difficult for you to give your honest feedback, especially to your own medical provider, knowing that they know exactly where it's coming from. So especially if you can create a way that you are doing this anonymously and blind, whether for the YLA it's just a sheet of paper. If it's just a sheet of paper, you can slip into a box or do it through a group like MOASH or TAC. AHI, where you can send them your materials that would help with your anonymity of the group. And your method is also a huge component of what type of feedback you're going to receive. So the group feedback from the YLA would give you a more overall representation of your healthcare center, like the bathrooms, your displays, your waiting room, how comfortable people are, and just general feedback. Whereas your individual project, the YEET, would give you a more specific information about your appointments and how a person feels while walking through the steps of your clinic. So those are two different types of feedback, and that goes into your decision of figuring out what you're trying to assess. Additionally, like making a plan for feedback to find out like how are you going to assess this information, whether it be sending all of your online forms to a group like MOASH where they can respond to you, giving your feedback back to you so it remains anonymous, and then how you're going to be using this feedback, and how you will evaluate and reevaluate your clinic based on what youth are telling you. And this also is really difficult to do, especially in our current times with telehealth, but there's a lot of ways that you could try to implement this type of feedback, even in our current situation, using QR codes for Google Forms, and the YLA tool being a sheet of paper, a PDF, can be given to patients online and submitted to an outside organization as well. So there are still ways that you can get involved and use such tools such as these in your healthcare centers now. And then additionally, there's a lot of difficulty in the thought process of getting people to submit this feedback. As I think Grayson did mention before, when we did this clinic evaluation as youth in advocacy council, we were compensated for our work. However, I think that oftentimes giving your feedback anonymously really empowers patients to share what they want, or and like brings them an opportunity to say things that they might want to say to a healthcare provider to improve their experience for not just them and for other patients. And it gives you that opportunity to do that without confronting a healthcare professional. So I think that automatically patients will be inclined to do this, especially knowing that their information is not going directly to their healthcare provider, but going through another source where their information will be anonymous. And also advertising specifically to youth commitment to making the space more comfortable, like informing your patients that you're trying to do something for them, like you're making the space more comfortable for them, might make youth more willing to do it for you, and wanting to make their voices heard in the process of you making your clinic more youth friendly.
Okay, so some tips if you would want to do this is empower your youth to contribute. So, you know, you want to actively incorporate your youth because they know what they're talking about. This affects them. And, you know, if they're being vulnerable to really give feedback, then you really want to truly hear them out. So the first step would be establishing clear forms of communication so everybody's on the same page. We all have busy schedules with extracurriculars, and same with providers. So really making sure that everybody knows when they're going to be at the clinic, at what time, and that really just communicates that both parties value each other's time. Don't make decisions and ask them to approve or disapprove. Again, you really want to actively incorporate them in this process. And then if it's part of a group project, you could have them share out their findings to the clinic. And this would be an opportunity. This is kind of part of that follow-up, an opportunity to elaborate, ask questions. And I would really recommend involving most, if not all, of the providers in your clinic, so everybody is kind of on the same page and knows what the findings were and what they could each do to improve. And then also consider how you gather the feedback. You want to make sure that it's anonymous and people aren't worried that you know, their provider or people will find out that it's from them, that they said that. And you could do this from, like Samporna was saying, with kind of like a survey that people pick up at the door or a QR code, or you could try to find a group of youth that understand the YLA and the YEET and are totally comfortable with being in those types of positions. Because especially with the YEET, I knew a lot of people who were not comfortable, you know, going and asking for a gonorrhea or chlamydia test. So you just want to make sure that they know what they're getting into and they know the whole process. And then also with some site considerations, be intentional on who you select as the person who's working with the youth. So, you know, there's going to be no health clinic is perfect. So there's going to be some constructive criticism and feedback. So you want to make sure that the provider that's hearing that, or providers, are open to that and really enjoy that feedback. And then create a timeline goal and bring it back to a larger team. So again, really getting the whole clinic involved and understanding what you want to achieve from this and the value of it from the beginning to the end.
Yeah, and lastly, all of these tools, both the YLA and the YEET, are available for you to use. The YLA is available on the Adolescent Health Initiative website, and it's available free to download at www.adolescenthealthinitiative.org. And you can just download this document and have it be used in your clinic, as long as you make sure that you are being aware of your group and how you're using this feedback. And additionally, if you would like to use the YEET tool, you can contact MOASH via www.moash.org and reach out, and we can assist you in putting the YEET tool into play as well. Yeah, for both of these tools, there are different uses and different methodologies that you might want to use, especially in an online environment. But yeah, we encourage you to use either one if you feel like this would give you adequate feedback back.
So at this time, we're going to pause and take any more questions. Just know that there will be some more closing thoughts at the end. So you can either chat it in or use the Q&A feature and we can answer some of your questions.
Thanks, Jaren. Just letting you know, at this time, we don't have any questions queued up in the Q&A, but again, feel free to chat in. I know we have about 2 minutes left of the webinar, but you have 3 really intelligent, fantastic young people here on panel that, you know, they could take your questions. So now's the time to ask you any burning questions. And if we don't have any questions right now, we're just going to close up the webinar with a few closing thoughts. But again, feel free to reach out to us with any questions that you might have after the webinar as well.
So as we close up, we wanted to provide some thinking points for everyone to think about after being provided with all this information. The first kind of thought and question being, what feedback have you received that was most valuable? So within your own practice and within your own clinics and things like that, the feedback either just from whether it be anonymous or from a patient, which was like the most beneficial for you? The next being, what do you think after this presentation is the most important to ask, specifically to your patients and to adolescent patients to receive the most valuable and beneficial feedback to better a clinic or a practice? And then the last question we would like to leave you with about what tool do you think would be the most valuable to your organization, whether that be the YEET or the YLA, or even if kind of thinking of something that you could create and implement yourself to provide to your patients and within your clinic, how that would be implemented and what that might include.
So those are some great closing thoughts that we hope to leave you with for the end of this webinar. So I just want to take a moment and say thank you so much for our participants for attending this webinar, and I hope you've learned a lot and can share with your colleagues afterwards. And then also just a huge thank you to Grayson, Samporna, and Jaren for doing an excellent job co-facilitating this webinar and giving your true feedback on the YLA and the YEET, and for sharing your experiences with us today. Just some closing up items here. Again, if you want to reach out to either MOASH or for AHI, we have our emails and our web address on here as well as the social. And there will also be an email going out after this webinar that will have the link to the recording and the slides and also our contact info. So if you want to reach out to us anytime, you're more than welcome to. So again, thank you so much for attending this webinar today, and we hope that you join us again for our next webinar coming up soon. Thank you.